What's up everybody, it's Blake here with Gorilla Zen Fitness. Today I'm going to be talking about another very frequent cause of lower back pain, and that is a tight quadratus lumborum. If you haven't seen my other exercises for low back pain, then be sure to check those out first before you watch this video right over here. So to kick it off, the quadratus lumborum is a weird little muscle that kind of connects to your bottommost rib or your 12th rib, the transverse processes of your lumbar spine and your ilium. Basically, it's attached to your lowermost rib, your low back, and the back of your pelvis. As usual, before I actually get into any techniques that release the quadratus lumborum, I'm going to go over a couple of ways that this muscle becomes tight and dysfunctional. Now, one of the functions of the quadratus lumborum, also known as the QL, is to extend the lumbar spine. Lower back extension looks like this. Now, I've talked about this before, but many people while at work or while sitting in a chair realize that they have bad posture, and in order to fix it, they force their lower back into extension. Frequently, people will stick their asses out while at work in order to give themselves the illusion of having good posture. It looks something like this. Doing this while in a chair or at work is one of the major contributors to developing tightness in that QL. So make sure that when you're sitting down, you're not hyperextending the low back. Another function of the QL is to laterally flex the lumbar spine. What that means is kind of like bend side to side. So lumbar lateral flexion can look like this. It can also look like this, where one hip is hiked up higher than the other one. Now, sitting on a wallet or leaning to the side talking on a phone, those are all putting your pelvis in a compromised tilted position, and both of those can cause tightness in the QL. Essentially, to avoid this type of asymmetrical QL tightness, just make sure that you're sitting evenly. Your low back should be in a little bit of an extended position, but not hyperextended. Make sure that your shoulders are rolled back and everything's just even. Keep in mind, you always want your head on top of your rib cage. You want your rib cage on top of your pelvis. So you don't want to be leaning forward, leaning back, leaning to the side, or anything like that. Another big contributing factor to that asymmetrical tightness of the QL is your sleeping position. Now, you can see visibly right here, if you sleep on your side, your right hip is actually hiked up. And in conjunction with the quadratus lumborum becoming tightened, you're probably also going to get some oblique and psoas tightness as well. Obviously, the best way to fix that is to sleep on your back. I recommend getting like a cervical pillow that kind of supports your neck so you can lay back on your back comfortably. Alright, so now I'm going to get into those release techniques. You know what's likely causing the QL tightness, so make sure to address those causative factors before you do any of these. Basically, what we're going to do today is we're going to use some pressure techniques to release the muscle prior to doing static stretches for the muscle. Remember, as always, consult your physician prior to trying any of these exercises, and make sure, like I said earlier, you address those causative factors first. In the first technique, I'm going to use a theracane. If you don't have a theracane, I'm going to show you a variation of this using a softball or a lacrosse ball, but just keep in mind a theracane is actually better. If you're looking to pick up your own theracane, you can go down in the description down below, hit products, and it's right there on my website. Alright, so basically, once you have your theracane, you're going to come right into the muscle, okay? I encourage you to Google the anatomy of this muscle so you can find it better, but it kind of runs down from your bottom rib here, down like this, okay? So the best way to get in there is to kind of put your theracane head in there, like this, okay? Push up on it. That's going to push the end of the theracane into your tissues there, and then you kind of just do this like you're rowing a boat, okay? A very painful boat. All right, look for the tender muscle in there, okay? It's kind of hard to find it, but just look up the anatomy of it and dig in there and penetrate into those tissues with this technique here, okay? This is very, very, very good at releasing the quadratus lumborum. I would recommend starting just underneath the lower rib and then kind of just working your way all the way down to your pelvis. You can use a softball or a lacrosse ball for this as well. However, it really does not work as effectively, but here it is. Basically, put it in the same spot and then simply like roll over onto it. Remember, you kind of want to come in from the side when you're addressing the QL, okay? And then from here, kind of just roll up and down. I forgot to mention earlier with the theracane, you can also contract and relax here, okay? That's a little bit, adding that factor in will help you get more release. So if you find that tight muscle, stay on it, squeeze everything, and then relax. And let that ball sink even deeper. Squeeze, relax. Okay, so that was all pre-release work, okay? that kind of loosened up and tenderized the QL. Now we're going to do some static stretching. So my favorite stretch for a QL is in a straddle position like this, okay? So basically what you do is you reach across your body using your opposing arm. So if I'm going to be reaching towards my left foot, I reach with my right hand and grab just outside of my foot here, okay? Right now I'm feeling a nice deep stretching sensation in my right QL. You're going to feel it there as well as the adductors and your medial hamstring stretching. So obviously to get the left side, I would reach to the right with my left hand, and I would also feel that down here in my QL. I really hope you enjoyed this video. If you haven't yet subscribed to my channel, make sure to do so over here. Also, take a look at my Facebook page. I'll include a link to that in the description down below. Thanks for watching, and I'll see you next time.